Biological disease-modifying anti-rheumatic drugs, biological DMARDs, can potentially exacerbate latent tuberculosis, TB, into active TB due to their immunosuppressive effects. Therefore, careful consideration is necessary when prescribing these medications to patients who test positive for TB but are asymptomatic. Here's the typical approach in such cases. 1. Screening and diagnosis. TB testing. Before initiating biological DMARDs, patients should be screened for TB using a tuberculin skin test, TST, or an interferon gamma release assay. Chest X-ray. If the test is positive, a chest X-ray should be performed to check for any signs of active TB. Clinical evaluation or any symptoms of TB, e.g., cough, fever, weight loss. Number 2, treatment of latent TB. If the TB test is positive, but there are no symptoms and the chest X-ray does not indicate active TB, the patient is considered to have latent TB. Latent TB is usually treated with a course of isoniazid for 9 months or a combination of isoniazid and rifapentine for 3 months, among other possible regimens. 3. Initiation of biological DMARDs. Biological DMARDs can be initiated after starting the treatment for latent TB, usually after 1 to 2 months of TB prophylaxis treatment. Close monitoring for any signs of active TB during the treatment is essential. 4. Monitoring and follow-up. Regular follow-up visits to monitor for TB symptoms and adherence to TB prophylaxis. Continuous assessment of the patient's response to the biological DMARDs and any potential side effects. Consultation with an infectious disease specialist is often recommended to tailor the TB management plan to the individual patient's needs and to ensure safe use of biological DMARDs.